Good morning. Today we'll be talking about case exam protocols and the appropriate patients to select for your subtests. The case exam protocols and the appropriate patients for subtests are located within the clinic manual. You have paper copies of the clinic manual at your home. There are paper copies in the clinic manual in the clinic. Additionally, there's a digital copy of the clinic manual in your Clinic 3 Blackboard site. There is a Clinic 3 manual located at each desktop at your unit, and these pages are separated and also on the desktop for easy access. On each desktop unit, you click on, it says Clinic 3 Skill Assessments and Case Exam Protocols. So let's go through these. So you may not begin taking a case exam until you have successfully completed your skill assessments. And the individual exceptions to this are noted in each syllabi, and they are usually designated with an asterisk or a star, and that means that you can take them at any time during the semester. For example, this semester it would be cure the oral prosthetic, panoramic, power, and there's another one. You may not do a skill assessment in conjunction with any case exam. For example, your older adult case exam, you may not do your skill assessment if you had one for engine polish at the same time. It has to be done on a different patient. It is your responsibility to track your case exams and the need for subtests. Additionally, it is your responsibility to be familiar with these protocols and the appropriate patients to use for subtests. Your tally sheets, which are included in the paper copy of your syllabus, may be kept at your clinic drawer. When you are testing, you must work independently. When a student selects to take a case exam, you must declare the type of case exam at the beginning. And you may request a modification if indicated by the patient assessment. So if it is found that the patient is a stage 0, but they're an older adult, you may switch it to an older adult case exam. I do get questions, well, how do I know if the patient's perio if I haven't done the perio assessment? Most of the patients that we see are at a minimum a stage 1, and so that counts as the perio case exam. Also, if it's a clinic patient or a patient of record, you may look at their old notes and find out if they were a perio patient in the past. So generally, each area of the case exam will be evaluated in the appointment it is performed, with the following exceptions. Calculus removal, so that will be assessed after each area is completed, and the total of supra and sub missed is documented. And then, of course, once completed, we will check off professionalism, safety, and critical thinking. So it's really important if you finish a portion of your case exam, for instance, the periodontal exam, that you have it checked before the patient is dismissed. So you need to leave an appropriate amount of time at the end of the appointment for those items to be checked. You need to know if you have to subtest on these sections because you may have a patient that comes in the afternoon that's an ideal subtest patient. So be very aware of your time, because if you only leave 5 minutes left in the appointment, that's not an amount of time that a periodontal exam can be checked. Patient selection protocols. You may not perform case exams or any subtests on any current or former dental hygiene students or dental professionals, including dental assistants, dental hygienists, dental lab techs, or dentists. Patients are not eligible to be a case exam if the student has tested on that patient previously. Subtesting is exempt from this limitation. So the patients that you have selected to be your older adult periodontal case exam this semester may not be your case exam in Clinic 4. However, you may use those patients as subtests for the case exams that you take in Clinic 4. Patients are considered to be appropriate for various case exams when they have approximately 2/3 or greater of their original dentition. So that means they need to have about 17 to 18 teeth in general. And again, your instructors may use their discretion in allowing you to take case exam on someone with fewer teeth. Students must adhere to the recommended recure interval for a patient to be eligible for a case exam. So you can't see someone in October and then you need a case exam and you tell them to come back in 3 weeks and they're going to be your case exam. You need to adhere, like if it was a 3-month recall that you had documented on their treatment plan and in their clinic notes, and we will adhere to that 3-month recall before you can do a case exam on them. So what happens if you don't pass and you need to do a subtest? So if you fail 4 or more areas on a given case exam, you must begin the entire exam again on another patient of the same category. So if it's a perio, you need to start a case exam again on another perio patient. If you fail 3 or fewer areas, then you may take subtests on those failed areas. Subtests need to occur after a failure of the category. So that means, you have to actually have gone through the dental exam and not passed it because you didn't fulfill a certain criteria before you take a subtest. So the failure comes first. Subtesting may not be done on an area that has been evaluated during the current episode of care. So what that means is you have your case exam patient and you have failed dental exam in the morning. Your afternoon patient comes in and you're on deposit assessment. You can't use the area of the dental exam that you've already been assessed formally at a prior appointment as a subtest. It needs to be new, something that has not been looked at by a faculty before within the process of care with you. So if a student needs to retest different areas in different case exams, so you have failed extraoral exam on a non-perio adult exam and failed education on a perio, the student may use one patient to subtest both of these areas, provided it is a more difficult type of patient. We'll look at the guide for appropriate patients when subtesting in a moment. Oh, I see an error here. Yay me. There, 1. And I'm going to take this MCC out and put stage. So if subtested on a perio case exam, any classification of perio, stage 1 through 4, is sufficient. So that means that you might have your case exam as a type 4, let's say, or sorry, stage 4. That means that you can subtest on a perio patient that's a stage 1. It doesn't need to be the exact perio stage that your perio case exam is. During subtesting, the student must retake the entire failed area. Calculus removal, you have to retest the entire area of instrumentation. So I just want to go to a different page here to show you what this means. So this is what it means. So there is a copy of this also located on your desktop within that case exam, Clinic 3 skill assessments and case exams. So if we look at these, I can see that this kind of creates like a box. So there's a box for health history, there's a box for extra and intraoral exam. So, and you'll notice the asterisk or the star after each one. So this means the clinic. So if you were in clinic 2, you're responsible for everything with 2 stars. So if you're in clinic 3, you're responsible for everything with 2 and 3 stars. So let's go to extra and intraoral exam. So palpates extraoral structures, evaluates head and neck, evaluates, all right, so intraoral structures. So let's say for this, on your case exam, you didn't know palatal torus palatinus. So you need to redo this entire box, I call it a box, and get everything right under 2 and 3 with the 2 and 3 stars. So the patient what happened is you didn't get torus palatinus. The next patient comes in, you say, I'm doing my extra and intraoral exam, and on that one, that patient that you decided to do, you didn't use descriptive terminology and identifying deviations. You were calling Fordyce's granules yellow spots. Let's say you said something was yellow spots. That subtest would also not pass because you did not use descriptive terminology and identifying deviations, like calling it a Fordyce's granules, saying a scar is a cicatrix, something like that. So you're responsible with the subtest to do everything within the box that has 2 or 3 stars. Now let's see, where am I? Okay. So the subtests that may be performed on a reevaluation appointment are medical history. Periodontal exam is only for Clinic 2. You may not do a periodontal exam subtest on a reevaluation in Clinic 3 and Clinic 4. Indices, professionalism, safety, and critical thinking. So we don't have to talk about independent practice. You need to make sure that when you're talking, when we say things like B, C, and D deposit, we're not talking about the grade. We're talking about the amount of calculus they have there. And then mixed dentition, that's all Clinic 4 protocols, so we won't review those for now. So I'm going to scroll down. So this is a document that you need to be familiar with because ultimately the responsibility is yours as a student to know that you are doing the subtest on the appropriate patient. So how can you be sure? You can look it up. You can look at the desktop. You can check with your mentor. But this is in writing and digitally in both clinics. So you need to be, you're responsible to know what you need, what the patient needs to be to do the subtest. So periodontal is this semester an older adult. So your periodontal case exam, you don't pass medical history. You can subtest on just about anyone. The adult, and just a regular non-perio adult, a perio adult, an older adult, a special needs adult, or your reevaluation. Where it gets really tricky, and what I'm hearing a lot of from students is, oh, I don't have another older adult. Well, then you need to know the areas that you're going to be subtesting on. You can only choose an older adult, and that's EOE, IOE, that's dental exam, that's dental chart. See, risk assessment, dental hygiene diagnosis, treatment plan, education. So you need to be well prepared prior to coming to clinic with your older adult. If that is a subtest that you could only use an older adult and you don't have another older adult, defined as age 60 plus. So really, really, really know this chart. You may not in Clinic 3 use a reevaluation appointment as your perio subtest. Right, you can see here the R is reevaluation for your older adult. So you could do medical history subtest at a reevaluation, you could do the indices, you could do professionalism, safety, and critical thinking, if that's it. So please be very well versed in these appropriate patients to subtest on. There's also, let me scroll down a little bit. There's a little key on the bottom that helps you decide what does SN mean? It means special needs. What's P mean? And if you have questions on this, connect with your mentor. Connect with me. Connect with a faculty member to make sure that you are selecting the correct patient. The time to figure this out is not when the patient's in the chair. It's before the appointment. All right, so if you don't understand what this chart means, or you have a difficulty reading it, or you just want to confirm, let's do it before the patient's in the chair. All right, so that's it for this rainy Friday afternoon.